Let's start. All right. So we have a small part left in cancer pharmacology, that is biological response modifiers. Now, biological response modifiers can be used in two ways. One is to improve your, see, main thing biological response modifier का मतलब ये है कि it is modifying your physiological response, normal response को modify कर रहा. All right. They can be used beneficially for a patient in the sense that one form of biological response modifier will be drugs that will improve hemopoietic growth. ठीक है. So biological response modifiers, we have the first type, which is hemopoietic growth factors. Hemopoietic growth factors. Now, hemopoietic growth factors में आते हैं आपका erythropoietin, myeloid growth factor. Myeloid growth factors are of several types: GCSF, MCSF, GMCSF, thrombopoietin. ये पूरे क्या करते हैं? You know that whenever we give anti-cancer drugs, there is a lot of myelosuppression. Okay, bone marrow suppression is very severe, because of which the total amount of anemia can occur very easily, and erythropoiesis is decreased. So what you can do is you can give hemopoietin. Hemopoietin growth factors like erythropoietin, yeah, myeloid growth factor, they will stimulate erythropoiesis. They will stimulate your bone marrow. Okay, so you are literally going against the drug in a way, because bone marrow depression is so significant because of antineoplastics. You will have to give something like hemopoietic growth factors to mediate that effect. Okay, then we have, that is one way of modifying your biological response. Then second way is by giving monoclonal antibodies. Now monoclonal antibodies में mainly आते हैं immunoglobulins. Okay, they are modified immunoglobulins. So these immunoglobulins will react with the antigens on cancer cells, and they will destroy the cancer cell. Okay, you can give trastuzumab, you can give rituximab. Okay, these two are commonly used in cancer. Okay, these are technically immunosuppressants, but what they do is they will react with the antigens that are present on the tumor cell itself. You will also see a decline in your normal inflammatory function, or your normal cell also will start getting affected. They will also get suppressed to a certain extent, but tumor cells पे ज़्यादा अच्छा काम करता है ये. Okay, they are essentially immunoglobulins, and they are antibodies. Okay, they are monoclonal antibodies का मतलब they are synthetically made antibodies. Okay, trastuzumab is specifically made in breast cancer, or it is used in breast cancer. Rituximab you can use in beta cell lymphoma. Okay, they will attach to antigen present on beta cells of your pancreas, and they will cause beta cell lysis. One problem is that rituximab, if you take for a long period of time, it can severely affect the normal insulin levels of a patient. Okay, generally you will give combination of these drugs. You will give combination of several different types of antineoplastic drugs. So you will combine one class with the other, and you will moderate the side effects accordingly. Okay, no, as such, there are a few nursing implications that you need to remember whenever you are giving antineoplastic drugs. Nursing implications. Okay, first of all, make sure that correct dose is being given to the patient, and correct dose is being administered to the patient. Okay, very important. Avoid direct contact with the drug. Okay, whenever you're preparing the drug, and whenever you're preparing the formulation, avoid direct contact. Okay, so avoid direct contact with the drug. um, make sure the correct dosage is being given to the patient. ठीक है, वेरी इंपॉर्टेंट करेक्ट डोज देना, क्योंकि थोड़ा भी ज़्यादा हुआ कम हुआ बड़े बड़े चेंजेस हो जाते हैं. ओके, मॉनिटर द इनपुट आउटपुट ऑफ द पेशेंट, यूरिन इनपुट आउटपुट. monitor iBio. Okay. Then now most anti-cancer drugs will cause severe vomiting. So what you need to do is you need to give an antiemetic like granisetron 30 to 60 minutes before you can actually give the antineoplastic. So give antiemetic 30 to 60 minutes before the antineoplastic. Okay. Now you have to tell the patient that they might suffer from hair loss. Hair loss is very common in almost all types of anti-cancer therapy. So you have to mentally prepare the patient for that. Uh, Make sure that pregnant nurses are avoiding anti-neoplastic in the sense that they avoid handling neoplastics. You have to make sure that pregnant nurses are not coming anywhere near anti-neoplastic drugs. Okay. uh, Pregnant nurses do not come in contact with anti-neoplastics. Okay. uh, Generally what happens is with repeated cycles of treatment, patients will become immunocompromised. So you have to make sure that aseptic conditions are maintained. If there is ever fever in a immunocompromised patient, generally patients who are undergoing several cycles of anti-neoplastics, they will become immunocompromised. उन लोगों के अंदर if you even see fever, report it very very quickly. ठीक है, they do not have a proper immune system to mount a response. Fever generally indicates that infection हो गया and it will what do you call, progress very very quickly. uh, Report immediately. Once again, if the patient develops fever, ठीक है, especially immunocompromised patients. Okay, very important. uh, Also avoid extravasation of drug because they can be very irritant. Extravasation is when leakage of IV occurs. Okay, from infusion site, avoid that as much as possible because it will be very irritant to the skin, all neoplastics. Okay, so those are some of the most important nursing implications that you need to remember, especially the one with fever. If you have a patient who is having fever, immediately report it because the patient is immunocompromised. Make sure that they are in aseptic conditions. Make sure pregnant nurses are not coming in contact with antineoplastics. Make sure to give an antiemetic. Okay, make sure correct dosage is being given. Okay, and avoid direct contact with the drug. So those are the nursing implications of antineoplastics. And with that, we have completed this thing, cancer pharmacology. I will get into Unit 8. Now, Unit 8 is about hormones and all. So first of all, we have anabolic steroids. Very small topic. Anabolic steroids are basically these are high anabolic and low androgenic activity steroids, synthetic steroids. Okay, they are believed to enhance protein synthesis. So generally, you will see bodybuilders. Some bodybuilders will use anabolic steroids for greater muscle synthesis and for greater muscle growth. Now, to increase muscle mass as well at higher doses. The problem occurs whenever you give anabolic steroids, masculinization occurs. Okay, especially in women, what happens is they will start having masculine features. The adverse effects are more significant with the anabolic steroids. These are basically testosterone injections. Okay, testosterone or chemicals that are similar to testosterone, उनके injections देते. So you have effects will be masculinization of women, acne will develop in women, hepatotoxicity. Okay, mainly used for protein synthesis. Once again, used to increase muscle mass and increase protein synthesis. Okay, That is the use of anabolic steroids. Now, adverse effects will be masculinization and acne in women. It can cause hepatotoxicity. It can cause increased libido. It can lead to precocious puberty. Precocious puberty is when puberty is induced quickly, okay, earlier than normal. So normally puberty comes around 12, 13, 14, right? 13, 14. Precocious puberty is when puberty occurs around 8, 9 years of age. Okay, that is because of anabolic steroids. अगर use करे तो generally in young boys. Okay. You can, there are some therapeutic uses of anabolic steroids. You can use it in catabolic states. If there is a disease that is causing muscle wasting, उसके अंदर anabolic steroids use कर सकते हैं. या फिर osteoporosis है, especially in older people, osteoporosis हो रहा तो उसके अंदर anabolic steroids use कर सकते हैं. Okay, some athletes use it for building muscle and all. Now, contraindications of anabolic steroids will be contraindications. You cannot give them in pregnancy. You cannot give them in carcinoma, carcinoma of prostate and breast in men. Okay. You cannot give them in infants and children because it will mess up their hormonal levels and it will what do you call change puberty, the age of puberty. It is completely contraindicated in renal, cardiac, and hepatic disease. The patient already has renal, cardiac or hepatic condition, उनके अंदर अब वो do not give this drug. Okay, anabolic steroids. That's it about anabolic steroids. Now coming to hormonal contraceptives. Hormonal contraceptives. One second. Right. अब hormonal contraceptives जो है, you will generally get either combined contraceptives or you can only get single contraceptives as well. These are mainly drugs that are uh, progesterone and estrogen. Okay, they are supplements of progesterone and estrogen. Before you read hormonal contraceptives, I will strongly suggest that you go over menstrual cycle once. Okay, if you understand menstrual cycle, it will be easier to understand how hormonal contraceptives work, because these are essentially substituents of estrogen and progesterone that you are giving in order to stop menstruation, in order to stop what do you call conception from occurring. ठीक है, यहाँ पर क्या होता है, in normal menstrual cycle you have phases, and in each phase you will have a certain hormone being secreted to a certain level. Whenever you give hormonal contraceptive, that balance of those hormones will get disturbed, because of which pregnancy will not occur. Okay, that is the idea behind giving hormonal contraceptives. So mainly combined contraceptives are given. Combined hormonal contraceptives. So you give a combination of progesterone and estrogen drugs. ठीक है, hormonal contraceptives को HCs भी बोलते हैं. Okay, HCs बोलते हैं, OCPs बोलते हैं, oral contraceptive pills बोलते हैं उसको, OCPs को. There are several abbreviations for this. Now you have low doses of estrogen and progesterone being given to women. Now अगर estrogen के है तो, so estrogens, the drugs will be ethinyl estradiol and mestranol. Okay, if it is a progestin, so these will act like progestins. Okay, the previous two will act like estrogen, these one will act like progestins. Okay, This is desogestrel and norgestimate. Okay, two drugs. Now, one thing about progestins is that it causes a lot of side effects. So these two are the ones that cause least side effects. Another reason why you combine contraceptives, specifically hormonal contraceptives, is to decrease their individual dose and decrease the chance of side effects occurring. Okay, so you have several drugs in them itself. You will have oral pills में monophasic pills रहते हैं, biphasic pills रहते हैं, progestin only contraceptives रहते हैं, then post coital contraceptives रहते हैं. We'll discuss them now. First of all, coming to oral pills. ठीक है, oral pills दो टाइप के रहते हैं. You have monophasic and biphasic. Monophasic pills, biphasic pills. ठीक है. Now monophasic pills, these are started on fifth day. ठीक है, fifth day of menstrual cycle. If you take an average, menstrual cycle can vary between 21 to 35 days. On an average, it is taken that 28 days is taken as an average. ठीक है, on an average एक normal lady में menstrual cycle will be for 28 days, but it will vary. Okay, in some patients it will be lesser, in some patients it will be higher. Now on an average, if you take a 28-day cycle, अगर आप 28 डे साइकिल देख रहे हैं, तो उसमें क्या करते हैं, you will start the pill on fifth day for the patient. ठीक है, fifth day of the menstrual cycle, and it will be continuously be taken for 21 days. So you take it from the fifth day all the way up to the 26th day. ठीक है, continuously you will keep taking for 21 days, and you stop it for 7 days. ठीक है, this 7 day यहाँ पर इसलिए mention कर रहे हैं क्योंकि this is the period where shedding occurs. Okay, when bleeding occurs, you will take a gap of 7 days. Those are monophasic pills. So you start on fifth day, you will continue for 21 days, and you stop again during bleeding. Again, when the next cycle starts on the fifth day, you start the drug again. ठीक है, वैसा cycle चलता ड्रग का. अगर biphasic drug दे रहे, this drug reduces the hormones that are needed for menstrual cycle. Okay, for normal menstrual cycle to occur, those are biphasic drugs. I will tell you mechanism of action of these drugs, because progestins and estrogen, they will have several places that they will act. Because आपके menstrual cycle में you will have an ovulatory phase and you will have a luteal phase. ठीक है, follicular phase and luteal phase, wherein changes are occurring both in uterus and in ovary. ठीक है, initially you have an oocyte that is being prepared for ovulation. Once ovulation is occurring, implantation, whether or not sperm is present, implantation will occur or will not occur. For that, your uterus will start preparing, it'll, lining will become thicker and all of that will happen. अगर वो नहीं हो रहा, तो what will happen after that? For all of that, I would suggest that you read menstrual cycle once. Okay, so that you clearly know where these drugs are given, for how long they are given, and why they are given for that long. Okay, you'll exactly understand then. Now, if biphasic pill में, if a lady misses one pill, ठीक है, दिन में एक लेते pill, if a lady misses one pill, second day में दो pills लेना. Okay, let's suppose they are on a cycle, and in that cycle they are taking one pill per day, and if they miss one pill, if they miss one of those days, immediately the next day दो pills लेना. ठीक है, to continue the course. If you miss more than two pills, okay, more than two pills consecutively, stop taking the drugs altogether and start again in the new cycle. Okay, if while taking the drugs you miss for more than two pills, okay, more than two consecutive days, stop it altogether and restart in the fifth day of the next cycle. Okay, this is also given on fifth day, started on fifth day. Okay, now if the woman has already conceived, for example, they have already conceived, pregnancy will be terminated if you give this drug. So because these drugs can be teratogenic. Okay, as I told you, these are normal hormones, but because they are given at such a time, your these hormones, your estrogens and progesterones, they are helpful both in conception and as a contraceptive. ठीक है, depending on कब दे रहे. राइट, डिपेंडिंग ऑन क्या टाइम पे दे रहे, बिकॉज दे विल इन्फ्लुएंस द लेवल ऑफ FSH एंड LH, okay, which are very important for ovulation to occur, and they are very important for uterus to get prepared. ठीक है, अगर वो दो नहीं रहे तो it will be a problematic. Now, as such, because you are giving this as a oral contraceptive, what will happen is if a lady has conceived and they are taking this pill, it can act as a teratogenic. Okay. If you want to continue with the pregnancy, stop taking the pills altogether, or else you might have to go to a doctor and consult. Okay. Now, as such, combined method, when you're combining progesterone and estrogen both, they will help in suppression of ovulation and they will thicken cervical mucus. When cervical mucus becomes very thick, sperms will not be able to move properly through the cervix and enter into the area of fertilization. ठीक है, जहाँ पर फेलोपियन ट्यूब्यूल्स में फर्टिलाइजेशन होता, अगर सर्वाइकल म्यूकस बहुत थिक है, दैट फर्टिलाइजेशन विल नॉट अकर. These combined pills will help in that. They will suppress ovulation and they will thicken cervical mucus. So both the ways it is helping. If you give only progesterone, frequency of ovulation will decrease, so only ovulation is affected. If you give only progesterone, only contraceptives, only ovulation is affected. Okay, so these are oral pills. Now coming to progestin only contraceptives. Not used a lot nowadays because progesterone generally tends to have a lot of disadvantages. It will cause amenorrhea. Amenorrhea is very frequent. Okay, menses menses will get very messed up. It might cause permanent sterility. So the patient might become completely infertile, and it will disrupt menstrual cycle a lot. That is why progesterone only contraceptives are not used. Now, the progesterone only contraceptive will be something called mini pill. ठीक है, मिनी पिल क्या है, इट इज अ स्मॉल डोज प्रोजेस्टिन, यू टेक इट डेली विदाउट एनी गैप. ठीक है, जनरली ईस्ट्रोजन के साथ अगर अकम्पनी करें तो जो लॉन्ग टर्म एडवर्स इफेक्ट्स होते हैं इसके, दोज कैन बी एलिमिनेटेड. ठीक है, इफ यू गिव mini pill alone, if you give progesterone only contraceptives, efficacy is not as much, it is not very efficient, and menstrual cycles will become irregular. That is why what you do is progesterone ke saath you mix estrogen generally, so that you can decrease the dose as well, and you can avoid adverse effects from occurring. Okay, then we have post-coital contraceptives. ठीक है, contraceptives that are taken immediately after coitus, after intercourse. ठीक है, now these are generally high dose estrogen. ठीक है, you give a very high burst of estrogen, and earlier ENP, estrogen and progesterone combo was given. uh, uh, Actually ENP is preferred now also because side effects होने का chance कम रहता. Even if you give estrogen high dose, yeah, if you give progesterone high dose, both of them will cause severe side effects. So you can decrease दोनों का dose, you can decrease dose of individual drugs, and you can combine those drugs and give them together, so that efficacy is increased and the chance of side effect from occurring are decreased. Okay, now as such, the pill should be started as soon as possible. ठीक है, within 72 hours. You have to take the pill less than 72 hours after coitus. Okay, if you take it after 72 hours, it is useless. Okay, highest efficacy will be you be around 90 to 98%. It's very good efficacy. Okay, almost 90 to 98% of times it will stop conception from happening. What you do is immediately after coitus you take 2 tablets. Okay, and you wait for 12 hours and you take 2 tablets again. Okay, this is happening within a window of 72 hours. If you're missing even these first 2 tablets within 72 hours, you might have to go to a doctor. Okay, if this is not possible, you can use a IUD. Okay, intrauterine contraceptive device, IUCD भी बोलते हैं उसको या IUD भी बोलते हैं. You can go to a doctor and get that. Okay, generally that can be used within 5 days of coitus. Okay, to prevent pregnancy. Now, generally, postcoital contraceptives are used in emergencies. in cases where rape has occurred, or in cases where contraception failure is occurring with the patient is, let's suppose the patient or the person is using condoms and they break, or something, some problem has occurred where either a female condom or male condom is not working properly, uske andar you take postcoital contraceptives. Now coming to mechanism of action of contraceptives, as I told you, it will do several functions. Okay, first of all, it will prevent ovulation. Now what happens is there is a negative feedback mechanism. If you read menstrual cycle, you will understand that whenever estrogen and progesterone are being secreted in your body at a certain level, they will send a negative feedback mechanism. So menstrual cycle is mainly controlled by two glands. There is hypothalamus and pituitary, specifically anterior pituitary. ठीक है, ये दो ग्लैंड्स कंट्रोल करते आपका मेंस्ट्रुअल साइकिल. ठीक है, दे आर रिस्पॉन्सिबल, एंटीरियर पिट्यूटरी स्पेसिफिकली इज रिस्पॉन्सिबल फॉर production of FSH and LH. Hypothalamus is responsible for production of GnRH, gonadotropin releasing hormone. Whenever your follicles, or specifically your follicles, आपके ovary में, they are releasing estrogen, at one certain level of estrogen in your reproductive cycle, what will happen is your body will see that there is enough amount of estrogen, and that estrogen will act as a negative feedback for hypothalamus to stop secreting GnRH. Okay, especially during menopause, what happen during this thing, start of menstruation, or let's suppose you have a pre-pubertal girl. Okay, someone who is around 7 to 8 years old. ठीक है, who has not yet reached puberty, उनके अंदर GnRH का प्रोडक्शन है स्मूथ. ठीक है, उनके अंदर कांस्टेंट प्रोडक्शन ऑफ GnRH होता है, where there is constant production of estrogen and progesterone. Whenever puberty is reached, let's suppose this girl is reaching puberty at around 13 or 14, whatever. Okay, at that point what happens is GnRH production becomes pulsed. Okay, it will be secreted in pulses. मतलब एक टाइम पे ज्यादा होता, एक टाइम पे कम होता. Okay, during that period of time what happens is it will correlate with menstrual cycle, in the sense that whenever estrogen production is increased, it is supposed to be increased, GnRH production increases, again it will go down. That decrease in GnRH specifically happens in response to estrogen. अब GnRH है, GnRH is causing the production of LH and FSH from anterior pituitary. ठीक है, FSH and LH in turn will cause ENP to be released, estrogen and progesterone. Okay, whenever the levels of ENP are increased, it will cause a negative feedback to your hypothalamus, where it will tell your body, okay, stop producing any more GnRH. We have enough amount of estrogen and progesterone. यहाँ पर आप क्या कर रहे हैं कॉन्ट्रासेप्टिव्स के साथ, when you give estrogen and progesterone at a wrong time, ठीक है, physiologically your body is not producing estrogen and progesterone till a certain time. When you mess that cycle by giving estrogen and progesterone externally, it will give a feedback, negative feedback mechanism to hypothalamus, especially progesterone. It will decrease GnRH production, and it will thereby decrease LH to be produced, which is essential for ovulation. Ovulation के time पे अगर आप progesterone दिए और estrogen दिए, it will decrease the rate of ovulation, and it will decrease ovulation from occurring, chance of ovulation from occurring, where oocyte is being released. Okay, estrogen specifically inhibits FSH. Okay, this fellow will inhibit FSH, progesterone will inhibit LH. Okay, estrogen suppresses FSH release by negative feedback on pituitary. Progesterone gives negative feedback to hypothalamus, estrogen gives negative feedback to pituitary. Both of them are in a continuum, but दोनों अलग अलग जगह काम कर रहे हैं, but the effect is same. Okay, ultimately what happens is when estrogen is affecting FSH, ovarian follicle fails to develop. ठीक है, तो ovulation होना अलग बात है, where oocyte is being released, and ovarian follicle development होना अलग बात है. Again, I would strongly suggest that you read menstruation once before you can understand this. Okay, progesterone also does another thing. It will inhibit estrogen induced LH release. So it will affect estrogen in such a way, body estrogen, okay, not the drug estrogen. Up estrogen and progesterone, let's suppose I'm putting E dash and P dash. Okay, these are the drugs that you're giving. ओके, ये ड्रग्स जो है ई डैश जाके एफएसएच को स्टॉप कर रहा, पी डैश जाके इसको स्टॉप कर रहा। ओके, आई रिमूव दिस सो दैट यू डोंट गेट कंफ्यूज्ड। ठीक है, ई डैश जो आप ड्रग दे रहे, आई एम पुटिंग इट एज ईस्ट्रोजन, सो मिसएंट्रॉल या मेस्टानॉल या फिर एथेनिल एस्ट्राडायोल विच आर ईस्ट्रोजन ड्रग्स। ठीक है, या फिर प्रोजेस्टिन ड्रग्स लाइक डेसोजेस्ट्रल या नॉर्जेस्टिमेट। ये ड्रग्स जब आप दे रहे, this drug is inhibiting LH and this drug is inhibiting FSH. Other than that, this drug progestin, it will inhibit estrogen induced LH release. So estrogen is inducing LH release. Okay, it will, estrogen in turn will cause LH release mid cycle, around 14 days. Estrogen will cause, 3 days before ovulation. What happens is, estrogen and progesterone levels will specifically spike, because of which LH and FSH levels will spike. 3 days before ovulation, instead of giving a negative feedback, it will give a positive feedback, wherein your body will start producing more amount of LH and FSH. Estrogen and progesterone increases, ultimately FSH LH increases. वहां पर नेगेटिव फीडबैक के बजाय पॉजिटिव फीडबैक हो रहा 3 days बिफोर ओव्यूलेशन। ये प्रोजेस्टिन जो ड्रग दे रहे हैं आप, it will stop that positive feedback from happening. It will stop estrogen induced mid cycle increase of LH. Okay, now progesterone does another thing. It will make cervical mucus thick, thickens cervical mucus. Okay, if cervical mucus becomes very thick, it will be unfavorable for the sperm penetration. Sperm will not be able to penetrate properly into your uterus. Okay, cervix का अगर mucus बहुत thick हो गया तो, uh, these hormonal contraceptives, both of them, they will do another thing on uterus. These are all changes that are occurring in the ovary, right? On your uterus, the endometrium, it'll make it so that hormonal contraceptives may create an unfavorable condition for implantation to occur. Okay, it will not let endometrium become ready. Endometrium generally becomes very thick before implantation, almost 6 centimeters thick. Normally endometrium is around 1 centimeter, 1 to 2 centimeter thick. uh, Once it is getting prepared for implantation, it will almost become as thick as 6 centimeters. Okay, 3 times बढ़ जाता, 3 to 6 times मोटा होता. That is in anticipation of implantation. अगर implantation नहीं हो रहा बोले तो, that is when shedding occurs, and bleeding में you'll see the cells of uterus and blood vessels that were coming. Okay, you will see spiral blood vessels that will release blood, and you will see blood during menstruation. Now these hormonal contraceptives, they will also influence coordinated contractions of your cervix. Okay, your cervix and uterus, also your fallopian tubes, they will contract normally. This contraction is so that ovum and sperm are transported near each other, so that fertilization can occur, fertilization and implantation. If these contractions are not occurring properly, those sperm and ova, they will not be able to move properly. Okay, so that is something that hormonal contraceptives will do. So these are some of the mechanisms of actions through which progestin and estrogen will work. Okay, there are several ways or several places that they work. Now, because they are messing up with normal physiological cycle, they will have a lot of side effects. Okay, adverse effects will include headache, migraine, breast tenderness. It can cause amenorrhea, because your body will start getting confused. Okay, amenorrhea. It can cause irregular menstrual cycles. Okay, it can cause weight gain, significant weight gain. It can cause acne, cause mood swings, and hirsutism. Hirsutism when you have hair growth all over your body in places where hair should not grow. In those places hair will grow, and the extent to which hair grows, that will also increase. The rate of hair growth will also increase. Okay, normally women do not have a lot of hair on their hands. Okay, I'm giving an example for when compared to, let's suppose, men, they do not have a lot of hair. Okay, even on their abdomen or other places they do not have a lot of hair. Hirsutism may, you will have hair growth in places where hair should not be present. Okay, abdomen, back, hip, hands, अलग अलग जगह facial hair बढ़ जाता, all of those. Okay, That is one side effect. Now there are more severe side effects as well. These are some common side effects. More severe side effects these of taking contraceptives will be, first of all, on CVS, especially in women who are over 35. Okay, one second. In women over 35-year-old, okay, it can increase risk of MI, myocardial infarction, and venous thromboembolism. So stroke can also occur because of that. It will increase coagulability. Okay. Newer drugs are relatively safer, but still they do have some risk. Okay, it can cause hypertension. Okay, can cause hypertension. It can cause cancer, okay, especially cancer of cervix and breast. Okay, it can cause cholestatic jaundice. Can cause cholestatic jaundice and gallstones. All right. Uh, it can impair glucose tolerance. All right. It can cause depression as well. Now, combined pill will have other side effects. They have lesser chance of causing side effects, but they are other side effects. Combined pill side effects. So this is when you give estrogens and progestins together. Okay, it can cause breast cancer. It can cause thromboembolic and cardiovascular disease. Diseases. Okay, it can cause liver disease. Be very careful when you're using it in diabetes, hypertension, or convulsion, seizure disorder, या फिर edema या CCF. ठीक है? So be careful when used in patients with DM या फिर hypertension या फिर convulsions या seizures कुछ भी या फिर edema and CCF. Lot of side effects associated with this. Okay. Contraceptives generally tend to have these many side effects because you are going against a physiological process. Okay, normally menstrual cycle is meant to what you call, make sure implantation is occurring and fertilization is occurring. यहाँ पर whenever you are giving a oral contraceptive drug, you are literally going against your normal physiology, because of which you will have several significant side effects. Okay, so with that